All right, great. We'll get started. Good morning.
Good morning.
I love it. Call and response. I'm Manhattan District Attorney Alvin Bragg. Thank you for joining us this morning for this important announcement of $9 million to address our mental health and substance abuse crisis. All right. Senator Jackson leading the way with applause. And I am particularly happy to be here with so many colleagues. I was noting the geographic diversity, which shows just the scope of the mental health and substance abuse crisis that's facing the city, and more particularly here today, the borough. I want to thank our hosts, Mia Muratori. We are in this great facility that's long been serving this community. I'm thankful to this institution for hosting us. I want to thank ISLG at CUNY and Michael Jacobson, Patrick Hart standing in for him today. They're our partner in all of our forfeiture fund work. So, yeah, Senator Jackson's clapping, folks. All right. I love it. I love it. No, it's right. You're right. Tom Harris from the Times Square Alliance, who's particularly the neighborhood navigator part of this, really gives rise from the great work in Times Square. And then my colleagues in government, Senator Jackson's leading the applause. We need to clap for you. And our other state senator, Brad Hoylman.
Hold your applause.
Okay, yeah. They've done this longer than I have, so we'll hold them to the end. Our council members, Eric Botcher, Gail Brewer, Carlina Rivera, who I know is on her way, was just texted with her, and Sean Abreu. Our assembly member elects, Tony Shimon and Alex Borez. And I see we're just joined by the Deputy Borough President, Keisha Sutton-James. I want to also thank, I saw one as I came in, Brian Weber from the Midtown South Community Council, Joe Restuccia from the Executive Director of the Clinton Housing Development Company, and Katie Savage, the co-chair of the 49th through 54th Street Block Alliance and founder of the Hell's Kitchen Litter Legion. I also want to thank my staff, who is working hard and long on this initiative all year, and in many ways, many of them throughout their career. Shireen Crawford, who heads up our Pathways to Public Safety work, who's long been committed to this. So let me dive in to sort of the meat of the announcement. I mentioned Mr. Harris. Also want to talk about our business alliance, our small business alliance this year, in meetings we've been having also with our community councils, our block associations. This really has been a collaborative process that has led us to really commit these funds to this. As district attorney, my role, as I've said this repeatedly, is to advance both public safety and fairness. These announcements today do exactly that. They are fairness and public safety announcements. By addressing this crisis, we address recidivism and thereby advance public safety. I think we've all had the experiences as Manhattanites and citygoers, disconcerting and sometimes scary to see our neighbors who are plainly unwell, whether it's openly using drugs or behaving in a disturbing manner, talking to themselves, either above ground in our streets or below ground in our subways. These individuals need help, as do our neighborhoods and our small businesses. We cannot ignore these issues and have people cycle through our court system again and again. And as I said, by addressing these human needs, we address the broader needs of public safety in our community. Our mental health infrastructure has long been inadequate. I grew up, my father ran homeless shelters. That was one of my first introductions to behavioral health issues. The system was inadequate then, but those who work in it, and I want to emphasize this, like my dad, were heroes for the work that they do every day, and we hope that the funding announced today will complement their efforts. That broken system was further disrupted by COVID, as all of our structures, from our civic structures to our churches to our mental health deliveries, were disrupted, and those who rely on the system that was already challenging to navigate had their services disrupted. That brings us to this announcement of $9 million today. It's broken into two parts for ease, and we'll not use all of the RFP, request for proposal language for ease. I'll refer to the first one as our neighborhood navigators, and the second as our court-based navigators. The first is preventative neighborhood-based interventions that are not linked to criminal justice conduct. The second, our neighborhood navigators, intervention immediately after the court process has begun, right at arraignment, that is distinct and separate from court-mandated programming. So both of these are completely voluntary initiatives that we are announcing today. I'm going to describe in some detail, because I think it's important to talk about how this is going to work mechanically, both of the programs. The first program, which is on the purely preventative side, will develop networks of neighborhood navigators who will build relationships with individuals who are unhoused, living on our streets, experiencing challenges with mental health or substance use. That grant solicitation for the neighborhood navigators is on our website today, so this first piece is going live today. So to paint a picture of what this will mean, think about a navigator out in our communities introducing themselves to a person who is sleeping in a park, panhandling, perhaps yelling at no one in particular. Maybe the navigator first offers a cup of coffee or a slice of pizza, initiates a contact, all towards gaining and building trust. Then perhaps the next day returns and on a cold day like today, offers a cup of tea, hot tea, and gloves and maybe some warm food. Eventually, and this is all about the human connection, again, the voluntary human connection, the navigator finds out the person's name is Joe, and we all have a Joe in our mind from our neighborhoods. Ideally, the navigator, steeped in experience in this, relates something from his or her own experience, and Joe opens up a little bit. Eventually, the navigator finds out that Joe has a medical condition, but doesn't have health insurance, or hasn't been able to address it, or doesn't know where to go first, given that Joe is uninsured. So the navigator helps with that problem initially, connects him, helps him get medication and stabilizes him, and then Joe's able to talk about other issues in his life, and slowly they begin to talk about longer-term solutions, like permanent housing or substance use treatment. And they stay in regular touch. This is how our neighborhood navigator program is going to work, and we know that because of past programs and the efficacy there. In addition to working with Joe, the neighborhood navigators will also work with our small businesses, others out in community, and help problem solve. Again, think of the Joes that you know and the issue that emerges or the issues that emerge, and then having the navigator to call and intervene and help de-escalate and help navigate, thereby how we get the name of our program. So that's the essence of our neighborhood navigator programs. And as I said, it comes out of collaborative discussion all year long from our partners. Based on those discussions, based upon data we've looked at, we've identified 4 focused neighborhoods. They are first Washington Heights and Inwood, second Chinatown on the Lower East Side, third Central and East Harlem, and fourth Hell's Kitchen, Chelsea, and Midtown West. In addition to those 4, we're going to have up to 6 based upon needs that will emerge during the request for proposal process. So that's the first, and that again is live today on our website. The second RFP will be issued in January, but we wanted to talk about it today, and that is our court-based navigators. And as I said, starting right at arraignment in our courts, but separate and apart from our court system, it will be sort of parallel, voluntary, and adjacent. The goals are sort of similar, to have the human connection established, and we see it in court, and if anyone wants to see the shortcomings of our mental health system, come on down to Manhattan Criminal Court or any of the criminal courts, and you will see an array of people with various needs that have caused them, in large part, to end up in criminal court. So the goal will be to set participants up for success in returning to court, completing diversion program, addressing the behavioral health issues, and laying the groundwork for longer-term treatment. And so I use Joe as an example for our neighborhood navigators. Let me have our illustrative Maria who, let's say, is arrested for shoplifting from Dwayne Reed. And the manager says, this is the third time. The arresting officer recognizes Maria. Maria then ends up in, as I talked about, criminal court. She goes to court, and based on the fact that Maria is presenting with behavioral health issue, she's offered diversion. That's something that we've been doing and scaling up in the Manhattan District Attorney's Office this year, separate and apart from what we're announcing today. So that diversion would require certain mandates for Maria to complete, attending appointments with a counselor, avoiding getting rearrested. But that's not all of the issues that Maria is facing. So connecting right there at arraignment, as opposed to saying, go somewhere 3 days from now, a neighborhood you've never known of, and connect with this unknown service provider. Right there in arraignment, while Maria is there, connecting her with service providers. This is going to help in a bunch of ways, right? In addition to whatever the mandated diversion program may be, Maria still has perhaps a food need, a housing need, a transportation need. And the central part of this is the development of trust, starting at that stage right there in arraignment. And these proven community-based supports, independent of the criminal justice system, we know, based on experience, will help break the cycle of recidivism and incarceration. So I want to close and turn to our government partners, and again thank CUNY and ISLG for its partnership. This has been a long-running endeavor. As you know, money's seized in connection with cases against banks and then put to advancing our public safety. And I'll just close by saying, these grants are rooted in observations throughout the year as I've seen the system work and not work, rooted in long-term observations. I mentioned my father's experience in homeless shelters, and rooted in data and performance, and really in the faith and the knowledge that community-based solutions, those with expertise and human connections will help those in need, and equally as important, help advance public safety. So with that, I want to turn it over, and I mentioned in the introduction, Tom Harris really in many ways is the inspiration, what he's done with the Times Square Alliance for this exact type of programming. So let me turn it over to Tom. Thanks so much.
Thank you. Thank you very much, District Attorney Bragg, and thank you for your partnership. I've been working with district attorneys since 1985. Most don't listen, some listen to be polite, but DA Bragg listens to learn and listens to affect change, and that means something, so thank you. The Times Square Alliance exists to make Times Square clean, safe, and desirable for all, including those who are unhoused, those suffering from mental illness, and those suffering from untreated substance addiction. As we recovered from the pandemic, we didn't want to leave our most vulnerable behind. Our Community First program is a partnership with the Midtown Community Court, Breaking Ground, Fountain House, and the Times Square Alliance. Our peer navigators meet people where they are, develop trust, we develop that human connection that the district attorney mentioned, and we help them on whatever their next step is to wherever they want to be in their road towards recovery or their road towards supportive housing. Together, we have provided services to over 400 unique individuals in the Times Square area, and we have reduced street homelessness by 2/3. When we started the program, 31 people were sleeping on the streets of Times Square. Tonight, we average about 9. We're between 9 and 12, depending on the weather. So that's a huge success. Our measures of success were simple. We wanted to provide services to individuals, and we counted how many people we provided services to. We wanted that number to go up, and we wanted the number of people sleeping on our streets to go down. Both happened. Success for us, for Joe and for Maria, is for them to move on in their journey to get supportive housing, to get the treatment that they need. Our long-term goal is to be put out of business. I'm thrilled that the district attorney is building on our successes and expanding this type of program, and we are happy to work with him and with the team. Thank you.
Want to acknowledge, I acknowledge you before you got here, but I want to acknowledge our Councilman Gil Brewer, who has joined us. We'll hear next from our state senators, Hoylman and Jackson, in that order.
Thank you. Thank you very much. Thank you so much. State Senator Brad Hoylman, what a pleasure to be here. You know, when the district attorney calls you and says, come to a press conference, you definitely show up. So, and for all the right reasons, because this is a model that really began here at Fountain House 125 years ago. So it's so appropriate that we're here in Hell's Kitchen where these programs really began. And Tom, thank you for your leadership, Tom Harris and the Times Square Alliance for replicating that model, that 125-year-old model, and making it a reality here. I'm State Senator Brad Hoylman, represent this neighborhood. Glad to welcome Alex Borres and Tony Simone, the newest members of the New York State Assembly. It's jarring not to see Dick Gottfried at a press conference in Hell's Kitchen, but we will work with and without him moving forward. This is something that I carry on my person, which is a funeral card of Michelle Go, who was buried back in January 15th, but had her service just 2 blocks from here. And I think it's a reminder of the failed system in which we operate, in which we ask our community to endure, and which points the direction toward much needed changes both here at the city level and, of course, in Albany. And I just want to thank the district attorney for putting so much resources into this program that will connect folks struggling on the streets to social workers who can give them the consistent support they need. We need to do more in Albany, whether it's getting more mental health beds, as Senator Jackson knows, making certain that the state applies for every penny of federal money, which Councilmember Botcher knows, but we will work in partnership with the district attorney moving forward. So thank you again, District Attorney, for this innovative program. We need it in Hell's Kitchen. Community Board 4 knows it, and we will make certain that the wider community shares in the benefits. Thank you very much.
Good morning, everyone. I'm Senator Robert Jackson, and I represent from 26th Street and 9th Avenue all the way up to Marble Hill, 13 miles of Manhattan. My colleagues have heard me say that loud and clear in the New York State Senate, because that's 13 miles, including 35th Street between 8th and 7th Avenue, in which I heard from my constituents about the issues and concerns that was happening in the streets, to the point where some of the business people hired security guards and posted them on the corner just to try to keep the neighborhood stable and safe. And I've worked with them, and I've worked with the NYPD in order to talk about these issues and concerns. And I was glad to hear our DA, Alvin Bragg, mention about Washington Heights and Inwood, because as of January, I will no longer represent Midtown, but I know it's in good hands with my colleagues here and over here. That's for sure. But this is a team approach, and you put this together in order for us to work from a humanistic point of view, you know? And so, as you said, building trust. I've had your trust, and you've had my trust as colleagues working together on behalf of the people of our great city. That's what this is about. And so I'm looking forward to the $9 million hiring navigators from the community that knows the communities, that are not afraid to go and communicate loud and clear to people that are in need. And I'd say, let's walk together in order to improve the outcomes of our community and the people that are in need. And I'd say, on behalf of all of us New Yorkers, thank you for what you're doing in collaboration with the others to make this work. Appreciate it.
Thank you, Senator. Thank you so much to Senators Hoylman and Jackson, on whose wise counsel I've relied on, not just this year, but previously, two stalwarts in the Senate. Want to turn to our Assembly members-elect, and new to these positions, but not new to service and to impactful measures in our communities. So we'll hear first from Assemblymember-elect Tony Simone, and then from Assemblymember-elect Alex Borres.
Thank you, DA Bragg. Look, the mental health crisis is not new, and the pandemic only amplified it. One of the reasons why I chose to run for this seat. We know there are ways to solve this problem, And it's not fear-mongering. It's hope. It's real solutions, talking to human beings. We need a safer city. There's no doubt about that. But I am so proud that we are focusing on Hell's Kitchen Midtown West. Joe will tell you, and Brian and others, what we've been going through the last few years. No New Yorker should fear walking down the street. And at the same time, New Yorkers pleading for help, for housing, for food, should be helped. We are the wealthiest city. We have to stop making excuses. We cannot arrest ourselves out of this problem. We can only solve this problem by ensuring those who are violent are not on our streets, and those who need help get the help. And I am going to focus like a laser beam, working with my colleagues who've already done a lot, Brad Hoylman, Robert Jackson, and others, on real solutions on increasing psychiatric beds and making sure this great plan that the DA has presented, a $9 million investment with neighborhood navigators, not assuming they know what to do just because you hold elected office, but working with the community board, working with Brian Weber and the Police Community Council and Joe Restuccia, who went through a lot of terrible things, what we saw on our streets. I live on 37th and 10th with my husband, 36th Street, putting mentally ill men all on one block. We didn't look at the human element. These folks are our fellow New Yorkers. We need to invest in our communities and give them hope and solutions. And I know we've done it before. When I worked in the city council with Speaker Christine Quinn, with Eric Botcher, when hate crimes were at all-time high and people said, you can't stop this, we did simple things and we did complex things, and we will solve this problem again by working together with real solutions, real funding, and ensuring the money is effectively being used every single day by talking to the community. And we will solve this problem. I know we'll have a safer, healthier, equitable, and more affordable city before we know it.
I'm so excited to work with Tony. I'm Alex Boris. I am the Assemblyman-elect for the 73rd District along the east side of Manhattan. And as DA Bragg said, not new to service, he's the third DA I've had the pleasure of working with. And I'm so thrilled at this proactive approach to mental health and to substance abuse disorder. We all know that the best time to give someone help is as early as possible. But if we don't succeed there, the second best time is, if they are impacted by the criminal justice system, is immediately upon arraignment, immediately upon a desk appearance ticket, and this approach is going after both of those times of intervention. I've been down to arraignments, and as the DA said, invite everyone to come and see what's actually happening. And speaking to a judge overseeing arraignments, she told me, you know, I wish I had other options. Many of the people coming through the system just need help. But I am constrained in what I can assign or what I can point them to. I don't have the discretion to give people what they really need. And this funding is providing new opportunities for what some people that go through the criminal justice system do actually really need. This is a really important issue, and we're not here, of course, to stigmatize those that have mental illness. We know that those that suffer from mental illness are much more likely to be a victim of a crime than to actually commit a crime. But it's on behalf of those victims that we have to take these steps to prevent people from ever coming in contact with the criminal justice system in the first place, to keep them away from committing a crime, and if they have, to reduce the recidivism that we're seeing and ensure that we can keep the entire neighborhood safe. So this will be a focus at all levels of government this year. That's why it's so great to have joining the DA members from the state and from the city and from outside of government. I'm thrilled to work with all of them to address this issue. We hope this $9 million are a success and just the start for more of these interventions to come. Thank you.
So my vision is getting worse with age, so I missed our council member, Carlina Rivera. We'll now turn to the city council. We'll do it in loose geographic order. We'll start with council member Carlina Rivera, and then stay in the neighborhood with Eric Botcher.
Good morning, everyone. I'm very happy to be here. I want to just thank the District Attorney Alvin Bragg. Has been really thoughtful on how we can be better partners and to look at neighborhoods that might not necessarily be considered to have a high-risk population. And the Lower East Side certainly has a history of being one with services and programs that are available, but it is one with high needs, with people who are living on the street in mental health crises, and especially our young people that are in desperate need of support and intervention. So I want to thank him for making these critical investments that will help fill the gaps that have for too long gone unfulfilled while many individuals and communities suffer. New York deserves a comprehensive, a person-centered healthcare system that uses evidence-based models to protect and promote the well-being of all communities across the city. And people need somewhere where they can walk in and be treated with respect. I started my career in social services. I was there doing eviction prevention, helping people find local medical services, a therapist, a psychiatrist, people that are involved with the criminal legal system. It is hard, painstaking, exhausting work. I know that meaningful local programming, a strong network of support is critical to the health and vibrancy of our communities. And so in the City Council, we have really tried to focus on securing resources, but when it's coming in a couple million at a time and has to be spread so thin among so much need, I just want to thank the District Attorney for looking at our community in the Lower East Side and for making a $9 million investment in this city, and I know that there is more to come. We need to get past what I think many people see as a piecemeal approach that fails to keep people safe and really has to prevent negative outcomes. And you've heard from my colleagues about what we witness. I'm a native New Yorker. I've spent my whole life here. Many people are sort of, they're afraid that we're going to go back to some other time, decades ago. But we have the infrastructure here. We need to make the investment. The safest communities are the ones that are invested in. You can see that between communities, whether it's the Lower East Side and the Upper East Side, or something as different as the East Village and the West Village. Healthcare staff, they're already overburdened, they're burned out, they've been working wonders with limited resources. We can't continue to point people towards systems that don't work and then expect frontline workers in hospitals and jails to shoulder the systemic failures that for too long our people have needed, and they've needed it to be urgently addressed. So this is about alternatives to incarceration. This is about diversion programs. This is about meeting people on the street. I'm excited for it. Again, it is really hard and difficult work that it takes a really nuanced approach and good communication. So I want to just thank everyone that is here. I'm glad to be here today. I want to commend his office for allocating these resources and look forward to the partnership. Thank you.
Good morning, everyone. My name's Eric Botcher. I'm the City Council member representing the Village, Chelsea, and Hell's Kitchen. I really want to thank District Attorney Bragg for your leadership on this issue and all my colleagues in and out of government for your partnership. How is it that in the richest city, in the richest country in the world, we let people die on the street from untreated mental illness? How do we let people cycle in and out of the courtroom, in and out of jail, 50, 60, 75, 100 times without meaningful interventions? We have failed so badly on our approach to these issues. And look, I'm someone who benefited from mental health treatment. It's something I talk about a lot. When I was 13, I spent a month in a mental health hospital following a series of suicide attempts. That treatment is the reason that I'm here today. It takes meaningful interventions in people's lives to save them. And the meaningful intervention for me was my mom deciding to check on me in my bedroom that night, the night that I decided I didn't want to live anymore. And the team of doctors and family members and insurance companies that helped me get that treatment. But what meaningful interventions are we providing to people living on the street with untreated mental illness, or people being arrested for shoplifting who have severe mental illness? The judges I talk to at criminal court tell me that there are very, very few, if any, meaningful interventions. The person walks out without having been helped. We can do so much better. We can do so much better. So that's what this investment is about today that we're announcing. Let this be the beginning of a turning point in our approach to these issues. If we really want to be the city that we know we can be, we have to get this right. We have to do this. Really want to thank the district attorney for this announcement and all my colleagues for being part of it also. Thank you.
Thanks so much, Councilman Abacha. There's so much power in our personal narrative, so I really thank you for sharing that and for flagging these issues for me throughout the year. And thanks to Councilman Rivera, who's also been really a great ear and guide throughout the year. So as I said, we'll move our way up the borough now and hear first from Councilman Bragg, who's been also a great friend this year. And then we will end with the singular voice of, I'm not going to forget Gail. I was just getting my run up here, the singular voice of Gail Brewer. So hear first from Councilman Bragg. He's been a great partner.
Well, I want to thank Eric for sharing his powerful story, first of all, and would also like to thank District Attorney Bragg and my colleagues here today. This critical mental health initiative will make our communities safer by utilizing public safety measures that actually work. And let me just say, aren't we happy to have a DA that is finally employing community-centric, innovative, but tested public safety measures? This program will work because it targets the key determinants of crime and provides key wraparound services before individuals become just as involved and after low-level court arraignment. We're going to make sure that our neighbors have housing, assistance, substance use treatment, and mental illness support because we know that prevents incarceration, because we know it's the right thing to do, and because we know it will allow folks to be in a secure environment. The Neighborhood Navigator and Court Navigator programs are one tool to ensure that New Yorkers don't get caught in a cycle of incarceration. For instance, when someone with substance abuse gets repeatedly arrested for low-level crimes, the old way was to lock them away. This frequently leads to escalating levels of involvement with the criminal justice system. But now, we're saying if we can address the challenges faced by that New Yorker, we can prevent them from being involved with the system in the first place. District Attorney Bragg is being very consistent on what he ran on and is actually keeping us safer, and it's also the right thing to do. I'm particularly excited that Washington Heights will be one of the focus neighborhoods of this program. It is a desperate need. We've had a lot of incidents uptown and things that and incidents that could have been prevented with the right investment. Thank you, District Attorney Bragg, for introducing this program and for all your hard work to keep Manhattan safe.
Singular voice.
I'm Gail Brewer. I appreciate being here. I represent the Upper West Side, and we're okay. We can handle the Upper West Side. Just wanted to know, I can handle the Upper West Side. But my question is to say, or my statement is to say, thank this district attorney for a past, and this ratchets up a lot the way in which we can approach social services. So today's daily news is kind of an example. So there's a wonderful article about this program, Navigator and Community, Neighborhood, and the folks that are going to get help at the court. And then there's an article about, with all due respect, those who are being taken off the subway, 3/4 of them are going back to the streets after they've been in a shelter for a few days. Then there's me calling all of the street outreach workers on a regular basis. And with all due respect, they're lost because they're, on one hand, they're supposed to be telling people, move on, and then the other hand, they're supposed to be talking to them and working with them to get them support for future housing. So they're lost, they're confused, they're upset, they're caseworkers. They're not people who are gonna tell people what to do if they're not comfortable doing it. So here is the best program. The district attorney and his phenomenal staff have come up, along with my hero, Tom Harris, have come up with the idea that you talk to people and you have the services. The street outreach folks, with all due respect, they don't have the services. So the judges, yes, they're constantly complaining to me there is no place to send somebody whom they would like to send. And the mental health workers, I met with 7 CEOs the other day, 40% turnover, they don't have enough staff. So this program will work. Yes, you go to the individuals on the street and you say, I have opportunities for you, because guess what? We really do have opportunities for you. And that's the buzz and the secret of this $9 million program. I think that the one on the street is slightly different because you have to sort of work with those who are already doing the street outreach worker and the community boards, and then the one that is in the courts. Those judges will love you forever because they want to do the right thing. I also go to arraignment, sitting there just listening, and I had all these crazy foster care kids that always ended up there. So I have a sense of what it is that is needed. What is needed are programs that work. And then, hopefully the $9 million can help to do the assessment and the follow-up, and did Maria stay where she was sent, and does she have any other issues, and how are we going to follow up? That is how you solve crises. My best moments are when I go, for instance, to Penn Station. I like that 8th Avenue because it's got an escalator. You can get the hell out of there on an escalator. And then I get to the top, and there are 4 people nodding out, or, you know, whatever. Hi, Gail, hi, Gail, hi, Gail. And the reason I say that, people want help. They want to know that somebody cares about them. At the same time, those of us in the street, in the neighborhoods, working, want to know that we're safe. There really is a common denominator here, and District Attorney Bragg has hit it. Thank you very much.
Thank you so much, Councilmember Brewer. And that experience you recount, I've been out with her, and everyone knows her. Reminds me of sort of when I was a child walking around, often on the Upper West Side, with my father, and unhoused people saying hello to him because they knew him from the shelter. Again, that human connection. So we're going to do some on-topic Q&A. I want to first, though, thank Tom Harris for the compliment that he gave me, which he says that I'm listening. And I wanted to just contextualize that for a little bit and thank everyone, all of our government and civic partners, for coming forward with their ideas. We've got 500 phenomenal assistant district attorneys in the Manhattan DA's office. I've been a prosecutor since 2003. We know how to build cases. We know how to prosecute. We do that very well. The ideas about connecting out in the streets, we have some great folks like Shireen Crawford and others in a division called Pathways to Public Safety. But these brilliant career public servants, both in and out of government, it's their rich ideas, and it's connecting with them. It's the late night text from Sean Abreu that I got the other day, or the phone call from others providing these ideas. And so this discussion and the vibrancy of it, I want to thank all of you for your service in leading, and we're really just partners here. Thank you so much.
Thank you.